Okay, so we're going to start with the lower leg, and specifically we're going to start with the compartments. So we're going to look at the anterior compartment at this time. We have the interosseous membrane, as you can see here. When we get to the ankle, you'll also be seeing some ligaments that we'll discuss later. But for right now, we're going to start with just the upper portion of the lower leg with all the muscles in the different compartments. First layer that we see is extensor hallucis longus. The reason for doing this is because the various muscles in each compartment share an arterial supply and a nerve supply, which will make your studying much easier. So here's the extensor hallucis longus. We can now see extensor digitorum longus, tibialis anterior, or the anterior tibialis. The next thing that we'll see is the actual sheath of the tendons of the extensor digitorum longus. That sheath is also present on the tibialis anterior and the extensor hallucis longus as well. We are now able to visualize the superficial fibular nerve. Superficial fibular nerve may also be called the superficial peroneal nerve, as it courses down into the foot. At this point, we can now see the superior extensor retinaculum and the inferior extensor retinaculum. This is now a view of the lateral side of the leg. We can see the fibula here. See its proximal head, distal head. Distal head is also called the lateral malleolus. We have the fibularis brevis. We have the fibularis longus. Posterior view, we're in the deep posterior compartment, popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So you want to look at this. This is flexor digitorum longus is here, tibialis posterior is there, flexor hallucis longus is there, and then these tendons actually cross at the ankle joint, and we'll look at that later. Which tendon is where when we get to the ankle joint for dissection. Note the tibial nerve. Okay, we're now entering the superficial posterior compartment, houses the soleus, or medial and lateral heads of the gastrocnemius, and of course the aponeurosis of the gastroc, which then forms the Achilles tendon here. We're now looking at the medial ankle, specifically the deltoid ligament. There is an anterior tibiotalar portion, the tibionavicular portion, the tibial calcaneal, which attaches to the tibia and then to the sustentaculum tali, and then finally the posterior tibial part of the deltoid ligament. Anterior tibiofibular ligament. This is the anterior talofibular ligament, lateral collateral ligament of the ankle joint. This is the calcaneofibular ligament. Posterior talofibular ligament. This is the posterior band of the tibiofibular ligament, extensor hallucis brevis, extensor digitorum brevis. As we discussed earlier when we were looking at the deep posterior compartment, we are now seeing the tendons of the tibialis posterior here. Add a layer, and we have the tendon of the flexor digitorum longus and the flexor hallucis longus. So the mnemonic that most students use to memorize the order of the tendons of the medial ankle will be Tom, Dick, and Harry, representing posterior tibialis for the T, flexor digitorum longus for the D, and flexor hallucis longus for the H. So Tom, Dick, and Harry. This small green slip right here is actually the tendon of the fibularis tertius. Fibularis tertius hangs out in the anterior compartment and is not well visualized in the previous slides, but will be important for you to know. Peroneus brevis attaches to the base of the fifth metatarsal, and then of course you're going to want to know fibularis longus. Now looking at the bottom of the foot, plantar calcaneocuboid ligament, plantar calcaneonavicular ligament. You now see the extensive attachment of the tibialis posterior. I'm sure you've written that down already, but now you can actually see it. This structure here is the long plantar ligament, and we can now start to see the various intrinsic muscles of the foot. This is flexor digiti minimi brevis. This is the interossei. We're now looking at adductor hallucis, the oblique head, adductor hallucis, the transverse head. That would make this flexor hallucis brevis. These are now the tendons. You can see the tendons of flexor digitorum longus and flexor hallucis longus, and how they're hanging out between the sesamoid bones. Sesamoid bones are living inside flexor hallucis brevis. Medial plantar nerve and its various branches. Lateral plantar nerve. It has a deep and a superficial. You have to know that. This is abductor digiti minimi. This is flexor digitorum accessoris, or quadratus plantae. And then this is abductor hallucis. And that would make this flexor digitorum brevis. So you got flexor digitorum brevis is superficial to quadratus plantae, i.e. flexor digitorum accessoris. Dorsum of the foot, we've already talked about this. This is extensor hallucis brevis, extensor digitorum brevis. Interossei you should already know from the last section. Here are the various extensor digitorum longus tendons. This is the plantar fascia, the central portion of it. This would be the lateral portion of it, and then this would be the medial portion of it. You see how extensive that is.